Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, October 21st, 2021, and I want to thank you for joining us for Facebook Live. As always, this is your opportunity to get your COVID questions answered. You can use the hashtag AskDrArwady on either Facebook or Twitter, and I'm really pleased to have a guest back with us today. A couple of weeks ago, a number of you had written in wanting to talk a little bit more about mental health and some of the indirects of COVID related to behavioral health, and so I promised you that we would bring back Matt Richards. He is the Deputy Commissioner for Behavioral Health at the Chicago Department of Public Health, so we work very closely together on all things related to not just mental health, but how that links together with our substance use work, some of our violence prevention work, and we're really proud of a lot of the progress that we've made even during COVID. And you know, a lot of what you hear me talk about here is very much about the physical effects of COVID, and that's what people tend to write in about. But we know that there have also been significant impacts to Chicago related to mental health. So we'll do a very quick look at the dashboard. I've got some slides to go through. Some of you were writing in asking why couldn't we do this on Tuesday? Because the Chicago Sky had won the championship. The video teams were actually out doing that, and so I want to make sure we get the CPS update in. So we got a lot to get through. So thank you again for being here. And you can start putting mental health questions in for him, a few COVID questions for me, and we'll get going. So first of all, our dashboard, chi.gov/COVID-. News is looking good here. We're averaging 281 cases per day. That's down from 326 a week ago, and we're getting closer to that 200 number that would take us out of substantial risk, and also be the point where we'd be able to be taking these masks off if we can get under 200 and stay there. Hospitalizations are looking good. We've got about 11 people on average being hospitalized newly every day in Chicago with COVID-19. Still have between 3 and 4 Chicagoans dying every day from COVID-19 here in Chicago. We're doing about 5,700 vaccinations every day, about 19,000 tests a day, and our positivity today is down to 1.9%. That's the lowest it's been since July 22. So really good to be seeing that improvement. Let's look at some slides quickly. So first of all, on Tuesday, we did release our update to our travel advisory. We're starting to see some progress. Hawaii, Florida, and Washington, D.C. all came off the travel advisory, joining California and Connecticut. Just as a reminder, these are the states that have fewer than 15 cases per 100,000 per day. That is the same metric we've been using all along. You can see a lot of the country does remain in that orange territory where people are unvaccinated. We do not recommend traveling, and there are recommendations around testing and even quarantine if people are returning from those. The fact that most of the country is still orange gives you a sense of that we are not done with this Delta surge, but definitely seeing some improvements. Here in Chicago, of course, on our risk matrix, that 281 case per day, that's in the substantial transmission range still. Again, the same that we've been using all along. And since Delta, CDC has recommended that jurisdictions in the substantial or high transmission category for cases keep those masks on inside. The rest of our metrics remain very good. As of today, our test positivity went all the way to the lowest category, that low transmission or low risk, when getting under 2%. So love to see that stay there. That's as much about testing enough as it is about COVID. And then our hospital beds, non-ICU and ICU, are both stable and in the lower risk zone. We've also been sharing this on social media this week, but we've put together, if you want to be fully vaccinated against COVID-19 for certain holidays, here's the dates you need to start by. So for example, Thanksgiving is the first one coming up, and you would have had to get your first dose of Moderna October 14th if you wanted to get your full dose, both doses of Moderna, and be 2 weeks post your second vaccine by Thanksgiving. Today marks the deadline deadline to get your first dose of Pfizer, if again you were going to get both of your Pfizer doses on time and be 2 weeks post them. And November 11th would mark the last day to get a single dose of J&J in time for that full protection before Thanksgiving. So encourage people, if you plan to be gathering for Thanksgiving, to get those vaccines now. Of course, you start getting some protection pretty much right away when you get vaccinated. So I don't want to imply that if you've got someone who really is insistent on getting Moderna, getting it now sooner is better, but we are coming up on those holidays. And you see similar dates here for Hanukkah, for Christmas, and for Kwanzaa. So Christmas, of course, will be a big gathering no matter what. You've got to get that first dose of Moderna by November 13, the first dose of Pfizer by November 20, and the first dose of J&J by December 11th to be fully vaccinated for Christmas. And I refer you to the others here. Quick conversations about boosters. As a reminder, right now, only the Pfizer vaccine is fully authorized and recommended by the ACIP and the CDC for a booster. So I got my vaccine, and maybe we'll talk about this in a second, because I know people were writing in about this. Last Saturday, I got my flu vaccine at the same time that I got my COVID booster, because I got my Pfizer vaccines more than 6 months ago. My second dose was more than 6 months ago. The people who absolutely should get a Pfizer booster are the people who had Pfizer first time around and who are over 65, who are over 18 in a long-term care facility, or who are over 50 and are at high risk of COVID because of underlying conditions. Others may get a Pfizer booster if you're over 18 with underlying conditions or over 18 and an increased risk of exposure to COVID for your job. So for me, I do have some underlying medical conditions, nothing that severe, but having some underlying conditions, plus, of course, I am out and about all the time with my job, and I'm a healthcare worker. I see patients in clinic. So I did make that decision to get the Pfizer booster, and I think if you're debating, I would recommend getting it. Yesterday, because I know we're already getting questions here, the FDA authorized Moderna and J&J booster. But let me remind you, there's 2 steps to having a full recommendation around boosters. First, the FDA, second, the CDC. So the FDA yesterday gave the authorization saying the safety data is good. We authorize that boosters can be given. Today and tomorrow, the CDC and the Advisory Committee on Immunization Practices will be meeting. There will be some final guidance and recommendations with a few more specifics coming out probably Friday, maybe over the weekend. So we will give very concrete guidance like we did for Pfizer in just a few days. But high level, just so you know, yesterday, the FDA authorized 1 dose of the Moderna vaccine at least 6 months after completing the primary series, with the same thing that they said for Pfizer. So age 65 and older, age 18 to 64 with underlying conditions, or at high risk because of jobs. So very, very similar to what we saw with the Pfizer recommendations. Those are the 2 mRNA vaccines. That's not a surprise. One note is that I expect that the dose for Moderna vaccine boosters will be half as great as the initial, and we can talk more about that next week. They also, not a surprise, authorized a dose of the Janssen or the Johnson & Johnson vaccine. That one can be administered at least 2 months after that single dose regimen. And that is authorized for everybody over the age of 18. And some of that is because although all 3 of these vaccines continue to protect really well against hospitalization and death, we have seen more breakthroughs where we look across the country with the Johnson & Johnson. I always tell people, if they're only going to get 1 vaccine shot, get the Johnson & Johnson, because people who only get 1 Moderna and don't get the second, or they only get 1 Pfizer and they don't get the second, don't do as well as people who get the 1 dose of Janssen. But with the data here, they are recommending, again, or at least authorizing, I should say, for those over 18. The CDC will give some more guidance here, so this isn't final, but I just wanted to fill it in. And then the third thing, which I know people will have questions about, we'll address more next week, is they did also authorize, looking at some data, a mix and match approach. So for people who completed a primary vaccination series with any of the vaccines, for J&J, for Pfizer, Moderna, they looked at safety data, they looked at efficacy data, and they said we authorize that you can get a different booster than the original one. CDC, again, will put some more guidance around this. This is primarily, for example, we have people who live in long-term care facilities who got Moderna vaccine, and we've not been able to give a booster yet because Moderna had not been approved. It gives some more flexibility in boosters, particularly for people who got J&J. There is some data suggesting that the mRNA, meaning either a Moderna or Pfizer booster, may be additionally protective. But we're going to share that data with you next week when we have formal recommendations. I just wanted to give you a sense of where that is because I know there's questions. All right, just to wrap up, chicago.gov/flu to find out where you can get your flu and COVID vaccines. We've been really happy. A lot of the aldermanic and ward flu and COVID vaccine clinics have been going well, not just for flu vaccines, but we've seen a lot of people getting those COVID vaccines. We had a open to the public and open to city employees vaccine clinic here at City Hall last week and did more than 550 vaccinations just in a few hours, like really good uptake here. Last Saturday at Kennedy King, again, is where I got at the same time my flu vaccine and my COVID Pfizer booster. This Saturday, 9 to 2, we'll be at Daly College and Truman College, and J&J and Pfizer COVID vaccine are available as well as flu vaccines. You can sign up online, go to chicago.gov/flu, or you can walk in. And then the last thing is just some data review from CPS, partly because we had to change the schedule on Tuesday. So everything, no change in terms of what we've seen. Case rate remains low. Since the start of the school year, about 6 out of every 1,000 CPS staff and students have had a positive COVID test and been present in school. Last week, the total was 0.06%, less than 1 out of every 1,000 staff and students across the system. Very, very reassuring. When we look at this each week since school has started, we have not seen any increase in the COVID-19 case rate as school has been in session, even while screening testing has ramped up. Again, very reassuring, exactly what we expected. We do not see schools. We did not see schools prior to vaccine. We have not seen schools around the country. We have not seen schools in Chicago be major drivers of COVID spread as long as you have appropriate mitigations like the masks and the other things in place. And so if schools were a significant source of spread, we would have expected to see this increasing. Instead, we're seeing it go along with what we're seeing in the community numbers, just as we would predict. Our number of quarantine and isolated individuals in CPS are going down, which is also a good thing as we've been working on protocols, as more people are getting vaccinated, and with the decrease from a 14-day to a 10-day quarantine across CPS in line with our recommendations. And data continues to show very few students are testing positive after close contact at school. So even where we are needing to quarantine kids, still just 1.6% from the beginning of school through early October. We always have to wait the 14 days to see if kids develop the symptoms, but this remains exactly where it was, so stable. We've had almost 20,000 students be close contacts of a person with COVID at CPS since starting school. 299 of them, just 1.6%, subsequently tested positive. And some of those likely were not actually even infected at school because you can have other contacts in the household. But again, very reassuring. And then screening testing is going well. They're in virtually, they're in all the schools at this point. And to give you a sense of this, last week there were 17,698 screening COVID tests across more than 500 CPS schools. 33 of them were positive, so 0.19%, 2 out of every 1,000 tests. And cumulatively, that's where we've been all along, and that is right in line with what we see with other school districts. We're at 0.2%. New York City is at 0.22% for the school year. And again, the goal is not to test every person here. The goal is to assess if we're missing it's surveillance. Are we missing COVID cases? Are there situations we're not aware of? And continue to work very closely with CEO Martinez and his team on all aspects. They're doing very well. Related to clusters and outbreaks, since the beginning of the school year, just a total of 26 in 26, and they have generally been very small. As a reminder, this is when we can't rule out in-school transmission. 20 of those were 2 individuals in a CPS setting. 5 of them were 3, 1 of them were 4, and so that means, technically IDPH defines an outbreak at this point in a school setting as 3 or more cases. So we would have had 6 situations in schools where there were 3 individuals that may have had transmission within school. But on average, when we are seeing a cluster and outbreak, the average size of that is 2.4, and we've never had one with more than 4 people in it. Most of these, 60%, involve students only, 20% involve staff only, and 20% involve staff and students. And in most cases, there is a clear risk factor, like people taking off masks in break rooms, or students in extracurricular activities, etc. The last data I want to share, just to set off really the rest of our conversation, is some update from our Healthy Chicago survey. We do this survey every year. It's a professionally done survey. It's at the same level that the CDC would use in its surveying. It's a random sampling. It's done through cell phone as well as through internet. They're sampling sort of across Chicago. We can talk details later. But every year we do this, and we did some extra surveying around COVID, and I've talked a little bit about this, some of the indirect impacts of COVID. So just to give you a sense, in this most recent survey, which was really looking at impact of COVID, about 17% of adult Chicagoans reported experiencing severe psychological distress during the pandemic, and that compares to 6.6% during our 2018 Healthy Chicago survey. So big increase during the pandemic, not unexpected, not different from what's been seen around the country. Of interest, Latinx Chicagoans reported the highest prevalence of reporting this severe psychological distress, about 20%. More likely, adults living in poverty, 27%. And loss of income, strongly correlated, meaning that people who lost their job more likely to have, severe psychological distress, severe depression, etc. And we know that's true, but I wanted to share the Chicago data. In addition, 68% of all adults reported feeling isolated from family or friends during the pandemic. 50% of adults reported feeling nervous. 30% reported feeling hopeless. More than 20%, 1 in 5 of Chicago adults reported starting and using alcohol more frequently during the pandemic. That is less likely among people living in poverty. That's a consistent thing that we find. And over 47%, almost half of Chicago adults reported starting or using marijuana more frequently during the pandemic. Not that 47% are using, but that increase for those who were. So with that, let me turn to you. Again, sure. Matt Richards, our lead for behavioral health at CDPH. Can you first just reflect on some of those statistics?
Yeah, I mean, I think, from the beginning of the pandemic, we planned for that.
Yep.
We anticipated, we would see impacts on people's mental health and substance use during the pandemic, and that's why we committed significant resources to those programs. We did not pull much staffing out of those programs to focus on COVID. I think when you think about loss and grief, when you think about social isolation and loneliness, when you think importantly about financial loss and financial insecurity, all of that affects our mental health.
Yeah.
That was true before the pandemic, right? And I think that's one important thing that's coming out of this, is mental health is not just some random thing that happens in your brain. Right? Mental health is very connected to things like your relationships with other people, whether you are worrying about your income frequently, whether you are socially connected to other people, are you able to get physical exercise, all those things. And so I think during the pandemic, we saw that confirmed over and over and over again. So part of the answer has been more services for more people, and we totally believe in that, the health department. But the other part of it is we've got to think about things like minimum wage, affordable housing, unemployment benefits if you lose your job. Yeah. All of those things increase and improve mental health. And that was true before the pandemic too.
Yeah, absolutely. Already getting a good number of questions in, so let's get right into those. Don Wolf on Twitter says, are kids experiencing more anxiety due to COVID? And if so, how can parents help them? And are frontline workers experiencing greater anxiety, and what can they do? I'll start by saying there is a child version of our Healthy Chicago survey that we do in conjunction with Lurie. And that's where I've shared recently some data about parental attitudes toward vaccines and what parents are worried about with their kids. That is where we get this. But in terms of the survey methodology, we survey adults. We do ask parents what they perceive in their children. There are different methodologies if you're sort of surveying children, but I just wanted to give that context, and then if you want to chime in.
Yeah, I mean, so during the pandemic, we saw a decrease in the amount of people that were going to emergency rooms generally, but we saw increases in the number of people that were going to emergency rooms for mental health issues, including for kids. So there was an increase in mental health issues among kids, including mental health crises among children. I think when you think about, so what can you do about it? When we're thinking about mental health for kids is very closely connected to support from parents and from their family, right? So that's where checking in with your kids regularly about how they're doing, providing support to them. I'm a big advocate of limiting screen time and limiting the cell phone use. Unfortunately now with social media, social media utilization is typically pretty emotionally arousing for people, and kids, especially who are teenagers and young adults, where the parts of their brain are still developing that have to do with regulation, they can be more kind of aroused by that stuff. So I think that's another thing to think about. Checking in about getting physical exercise. If you have concerns, if your child is making statements about suicidality, if they are self-injuring, for instance, cutting themselves, if they're expressing anxiety, if you're noticing changes in their school performance, I would encourage you to check in with them and with your pediatrician. It's always important to include the family pediatrician.
Yeah, and I would just add, I think, I've had the opportunity to be on a lot of conversations with teenagers in particular. We work closely with CPS, and that didn't stop during COVID. And there were really interesting conversations about how teenagers in Chicago were getting mental health supports. We had, for the first time, we were doing a lot more telehealth, and some younger people are very comfortable in the Zoom medium, some are not. Really interesting conversations about how to destigmatize, how to sort of normalize this for kids. And we've had, for those of you who've been following along, we've had a number of practitioners and pediatricians on who talked about, over this last year and a half, a lot of the concerns coming in, partly because of the masks and the vaccines and all of this, much less of the infectious disease, bread and butter, antibiotic work, and much more, concerns. Because when adolescents in particular are developing, those interpersonal interactions are really important. And one of the main reasons I was so focused on being back in school was because that ability to have that interpersonal interaction, especially important for development and for mental health.
And I think for parents, really being proactive about checking in with your kids, I think talking to parents a lot, sometimes they don't know how to start that conversation, and kids, in my experience, often signal how they're doing through their behavior and less through what they're verbalizing or saying. And so really wanting to empower parents and loved ones and teachers to take the initiative to start that conversation with your child. And normalizing, mental health is health. It's okay to feel down. It's okay to feel anxious. Providing some really tangible suggestions of things you can do to feel better, like limiting your screen time, like doing things that are relaxing, that can calm you down, getting physical exercise, things like that. And if you need another opinion, pulling in your family pediatrician.
All right, I'm going to take a couple of boosters real quick, booster questions. First of all, the COVID booster webpage is live. You can go to chicago.gov/COVIDvax to get questions answered. But very quickly, Teresa Davis on Facebook says, what is the likelihood I can get a Moderna booster soon? I had my one-time J&J shot back in April. I don't want a second J&J. I didn't like the side effects. I'd rather get Moderna. I think the likelihood is extremely high that as of probably Saturday or Sunday, as soon as the CDC gives the recommendation, that you would be able to get that Moderna vaccine. But again, we will have formal guidance for you Monday next time, but chances are very good. And Sarah Pollock is asking another really good follow-up on Twitter. For those who got the J&J vaccine, do we need to get both doses of an mRNA one, Pfizer or Moderna, or is just one effective? One is effective. And even J&J, for people who got J&J first and they get the second J&J, or they get the Pfizer or the Moderna, it's one. So excellent questions. Just to get a few quick ones in, and check out the website where we've got more. Okay, some more mental health things here. So, okay. This is a question that we certainly get a lot on Facebook. Why aren't you reopening CDPH mental health clinics that were closed by Mayor Emanuel?
Sure. So if you go back to 2019, which is when I started working for the city had a $12 million mental health budget, and we were providing services to 3,600 people a year. Almost all of our money as a city was going into the 5 clinics that we operate. So think about that. You are in a city, third largest city in the country, 2.7 million people, and the city of Chicago's mental health program is reaching 3,600 people a year. That is nowhere even close to where we needed to be. So the first thing I said when I looked at that is we need to get way more services to way more people, way more quickly. And so what we've got to do is we've got to increase the budget, which the mayor has tripled it, and this new budget, which I'm excited to talk about, increases it by 7-fold, more than any other mayor in the history of the city. We've got to get money, we've got to get capacity building to the hundreds of clinics in our city. We operate 5 of them that provide services to any resident in our city, regardless of their health insurance, their immigration status, whether they have any money. So that's what we did. We invested $8.5 million a year into this network of mental health centers, federally qualified health centers, community mental health centers. We invested millions of dollars in our own clinics. So we were doing both things at once. And what we've seen 6 months into this year is that we've delivered services to around 26,000 people this year.
So hold on, let me back that up.
Yeah.
So 3,600 people in all of 2019.
Correct.
And then
26,000 just in the first 6 months of this year.
Okay.
So I think we're probably on track to serve 40,000 people this year. That's a conservative estimate. So what is that? 13 times as many people as in 2019. So more services, more people, more quickly, right? That's what it's all about.
Yeah.
And so having the increased budget from the mayor has been critical to that. I think being able to make investments in our 5 city clinics, hiring more therapists, more psychiatrists, that's been critical. And then making this investment in the much larger system has been critical.
Yeah, and I would just add maybe, one thing to that is that I think we hear, we get this question a lot. And I know it can sound strange to say, well, of course you would want to, reopen clinics. And we are, of course, in support of outpatient mental health clinics. But where you think about where resources are really needed, we're trying to think a lot about what is the role that public health and city public health plays and needs to play in the mental health system. A number of you are writing in with comments here. I don't think it's a secret to anybody that we don't have enough mental health services, and we've not really had a good system for coordinating among all of the places where people can get mental health services, regardless of their income, regardless of the ability to pay, regardless of their insurance status, regardless of their immigration status. And we've really kind of left people on their own in some ways to navigate that system. So, of course, we're investing in the clinics that we have. And for the first time in years and years, we're bringing in some people who can do child and adolescent mental health work. We haven't had that. We just, there are a lot of kids who acutely are needing this mental health care. So while we continue to build it in our system, we're supporting more access in the hundreds of places that serve and want to grow access.
And you have to do that in the 3rd largest city in the country. I just want to be real clear about that. There is no other serious strategy. You have got to get into hundreds of clinics across a city as large as Chicago if you want to seriously deliver mental health services to hundreds of thousands of people. And in the 3rd largest city in the country, that's what we're talking about. We're not talking about 5,000 people or 10,000. We're talking about hundreds of thousands. So it's always been a question for us of we need more money And we've got to get more services into more clinics, not just the ones we operate because they're about 1% or 3% of the overall system. That is what you have to do. There is no other serious strategy for getting that done. And I think what we've seen so far is good results. The promising results. The government, one of the government's roles has to be coordinating the system. If you have a loved one or you yourself have had a mental health struggle, the mental health system can be very difficult to navigate. And one of the reasons why is because government, not just city of Chicago, not just city governments, government in general needs to do a better job of coordinating the mental health system to make it easier to get services. So one of the things we've done, we have a new mental health website for the city of Chicago, mentalhealth.chicago.gov. You can go to that website and there's a resource finder in there, and you can put in your zip code and it'll tell you what services are available in your community. If you have questions, you can call you can call 311, or there's a NAMI helpline, which is one of our partners. They can help you, talk you through what your options are. That's an example of the type of thing that government has to do. Mm-hmm. We can't ask the healthcare system to just organize themselves. Government's got to help do that. And so we've grown a team of people that are doing that, and that's been part of our plan.
So we're getting some questions here. I think this is a good one, and I've heard people ask me this personally. Yeah. It seems like there are a lot more homeless people in my neighborhood who have mental health issues. What's going on? So
there's always been thank you for that question. There has always been a significant interconnection between being chronically homeless and having underlying untreated serious mental illness and substance use disorders. So one of the things that we've seen, I think, during the pandemic is that homelessness has gotten worse, and homelessness was becoming worse, preceding the pandemic because of the lack of affordable housing in the United States. In addition to that, we've seen in the city of Chicago that 90% of our folks that are chronically homeless and really utilize the emergency room system a lot, 911 system a lot, come in contact with the jail system, 90% of those folks have underlying mental health issues. Mm-hmm. And so one of the things I'm most excited about in this budget is we're actually standing up a model where we're going to be building a housing facility. The goal is 50 to 60 beds, where you're going to have psychiatry, substance use treatment, primary care actually integrated into this building. So folks that are houseless, that are perhaps in neighborhoods such as yours that are really struggling, we can actually offer them entrance into this housing. We can provide them with those wraparound services to help them get stabilized, and then we can link them into housing in the long term.
Yeah, and let me just chime in on that, because it's one of the things I am the most pleased about when I think about some of the indirect effects in a good way that COVID has had on our city and on CDPH. Getting more funding, like hugely more funding for mental health, I think is so critical, and it's been good to see. But also, during COVID, we learned, we had the opportunity because we needed to move quickly and think differently about people who were experiencing homelessness. So just to kind of,
yes,
the Wayback Machine here, if you remember, we had a lot of people who were in shelters, and there was no ability to socially distance. These are a lot of people who have a lot of underlying health conditions, high risk. Here in Chicago, we made the decision not to wait for people to get COVID. Very quickly, we worked to get testing available, and we've continued to make it available week after week after week in homeless shelters. We what we call decompress those shelters, opened up a lot of other spaces where folks could move. And then we had something called shielding housing, where people who were in shelters or otherwise did not have a home could, and who were older or had underlying conditions, we put them in hotels, right? The hotels were not being used. And then what we saw in these hotels was people stayed for a few months, typically.
Yep.
And every single day, we had a whole host of folks in helping get people stabilized. So really working on what are their mental health issues and getting the medications that they need. What are their physical health issues? Is there diabetes that's not addressed? Are there substance use issue? What does that look like? Let's make sure we help figure out that they're all signed up for the benefits and can get the support. And we saw such success with that, that we were able to transition a lot of these folks after COVID COVID into long-term supportive housing. And so it really is sort of this direct outgrowth from COVID learnings that then said, as part of the proposed budget, we're going to put $12 million in because these are the folks that very, very often are not getting connected and having the ability to do housing. It is relatively expensive to do that kind of work, but those people and other people who have the kind of mental illnesses that make it, sometimes they don't even recognize that they have a mental illness, they're not very likely to come in for a 10 o'clock appointment on a Thursday at a mental health clinic. And so the thing I'm the most excited about is all of the work that we've been doing outside of clinic walls, frankly.
Yes.
Because, prior to 2019, when this mayor came in and when we started really funding mental health more aggressively, and not just thinking about the very small number of clinics that we operate, which I'm committed to, and we care about them and we're investing in them, but really, where do we have gaps? For me, the biggest place we have gaps are all of the people who need more outreach. And so we've also been doing work, we're integrating mental health professionals into the 911 response system for the first time. We're sending out teams to people in, your neighborhood who might be experiencing homelessness, not waiting for them to reach out or make these outpatient visits. And we are then connecting them to outpatient or inpatient care. We're doing a lot in the substance use space too, where if people are after an overdose, can we work to get them connected to care? There's a lot going on. But so, for me, it's about, it's sort of clinics, and it's that we are interested in growing and expanding the access to outpatient mental health care, but it's all about lowering barriers for everybody, not just thinking about the people who can make an outpatient appointment.
Yeah, I mean, the system that we need for folks living with serious mental illness and co-occurring substance use disorders is different than the system that we need when we're talking about like your local community mental health clinic, where if you have anxiety or depression or a stress-related condition. Both are very important, but there's a different blend of things that you need. So when we're talking about the let's say 5,000 people in the city of Chicago that are chronically homeless, that have serious mental illness and substance use disorders, we've really got to look at how do you pair housing plus complex services. We've got to look at coordination with the criminal court system, because unfortunately folks are coming into that system which is not at all set up to address their needs. There's a lot of system coordination work that has to happen there.
Yeah. So Alex on Facebook here says, I don't know if it's a he or a she, has a family member that has been drinking for many years and is now struggling with severe anxiety. He doesn't think his drinking is a problem or that it's connected to his anxiety problems. Says was interested in the data we showed that more people during COVID have been drinking. What can Alex, he or she, do?
Yeah, I'm sorry you're having that experience. It's unfortunately a fairly common one. So there's a very close interconnection between substance use and mental health conditions. So over 50% of people that have a substance use disorder, in this case it sounds like it could be alcohol use disorder, also have a mental health condition. So, if you're somebody that has a substance use disorder, much more likely to have anxiety, much more likely to have depression, much higher rates of folks that have personality disorders. And so it's really important to address both at the same time. I think it's also very common that a person may not believe that their substance use is a problem. And so one of the things I would encourage you to consider in this case is, how do you communicate to your loved one how their substance use, what you're observing about it, and how it's impacting you and how it's making you feel. And to share with them that there is help available, that you'd like to see them take advantage of that help. And if they're not willing to accept help, what are the things that you're going to need to do so that their substance use is not adversely impacting you? What are things you can do to care for yourself? Because it's often a process for somebody to come to understand or believe that their substance use has become problematic.
Yeah, we also have proposed in the new budget actually about $5 million for a sobering center, which is, again, we have a real focus on trying to help folks whose primary issue is a health issue, whether it's alcohol use disorder, opioid use disorder, any substance use, mental health issues, divert them from the criminal justice system. So instead of law enforcement or even, paramedics, ambulances, necessarily needing to handle it, actually having some best practices that a lot of other cities have in place. So, I would just say we don't talk as much about alcohol use disorder, but it's a problem.
It's a very prevalent problem, and there's a lot of treatment out there that works. So with your loved one, things I would recommend you consider, as far as offering them help is, would they be willing to go meet with their physician about their substance use and talk to them about it? Would they be willing to go to a recovery meeting? So that could be something like alcohol, it could be AA, it could be, there's a program called Refuge or Smart Recovery. There's different communities of people in the city of Chicago in recovery that support one another related to their substance use. There are alcohol use disorder treatment programs, which you can look up on our mentalhealth.chicago.gov website. Some of them are referenced there. The most important predictor, if you have alcohol use disorder, of moving into a recovery process is wanting to move into a recovery process. We see that in the research over and over again. A person really has to be at a point where they are willing to commit to receiving treatment, and treatment usually works over time.
All right, so there's a few folks writing in with some interestingly framed questions. So let's kind of hit a few of these together. At Gray Bam on 1030 from Twitter says, here's a question you never want to answer. What is your plan for the mental health issues you are creating for making children wear a mask for 8 hours a day? So let me start and then I'll let you chime in.
Sure.
So I think for me, where I have seen true mental health issues for children, it has been where they have been isolated, where they have not been connected to social interactions and structures, and where the whole world changed during shutdown, right? Can be very confusing and destabilizing for children. I am thrilled that we are in a place from COVID that children can be out and about in the world. And I am thrilled that they can be back in school, they can be out, and part of, then some of you are also, there's some other questions here about masks, et cetera, and mental health from that. The masks are part of what help us while we remain in substantial or high transmission per CDC recommendations. They're part of what let us keep open. They're part of why I'm so proud going all the way back to May. We have never shut anything down since then. I don't want to. So for kids, I'm not so concerned about, quote, mental health issues from wearing masks. I'm concerned about having to,
for kids, structure is really important. So our ability to get back to life that is as much as normal as possible is really, really important. And so I would hate to see COVID get to a point where things are getting shut down, where it's impacting the structure of school, things like that. And so actually doing things that can control COVID is going to help their lives get back to normal as quickly as possible. And for anyone who's a parent, you know that experience of kids needing to have a predictable structure. And that is what has been so difficult, I think, about COVID, is the interruption in all of our routines. I think generally masks themselves have not been it. And I think when I have spoken to folks about this, it's usually the adult is particularly distressed about the mask because they feel like they're being forced to do something they don't want to do. And I get it. Nobody wants to feel like you're doing something you don't want to do. But what I would leave you with is the ultimate experience of feeling out of control would be to get really critically ill and to not be sure how it's going to unfold and to have to worry, are you going to be here for your child? Are you going to get to see them grow up? It breaks my heart when I see parents on TV talking about that, how awful that must feel to be like, I wish I could hit rewind and go 2 months back. So I get that it's hard. I hear you, we're gonna get through it, but this is just one of those things in life, we just kind of gotta do it for now. I understand it's not, it doesn't feel great, but we're gonna get through to the other side. I really do believe that.
Yeah, and you have to understand that my team continues to call every person diagnosed with COVID-19 in the city of Chicago that is reported to us. And most of those folks, when they pick up the phone and have
Yeah.
conversations with us, not always, but many of them are extraordinarily worried at that point.
Yeah.
Who were they in touch with? How sick might they get? You know, I've got some close family members who have, just had breakthrough COVID. They were vaccinated, but they were diagnosed with COVID, and it brings a level of worry for that individual, for everybody who cares
Yeah.
about them, and then for people who have been diagnosed. Oh my goodness! Like, especially when folks had not gotten vaccinated to that point, not from an anti-vax stance, which we've talked about a lot, is not where most unvaccinated Chicagoans are. They're just waiting, they're concerned, and it just breaks your heart. I hear this, I mean, imagine this. I've got team members who have been doing this day in and day out for 19 months, talking to Chicagoans who have just been diagnosed with COVID. We've been also thinking about their mental health and supporting it. But so I know there's a lot of drama about masks, and where people are kind of showing that we've got some other people saying you're changing goalposts. We're not changing goalposts. All along, on the way up, we made the recommendation that when we were over 200 cases, we recommended masks indoors, and we required them over 400 cases. Then with the Delta strain, which has been so problematic in this country, CDC more strongly said indoor masks for substantial or high risk. When we come down out of substantial risk, under 200 cases, and we stay there, we'll drop the mask. But if this is what you're ruminating about, this is what is affecting your mental health, let me tell you, there are thousands of people in Chicago who are ruminating about much more direct impacts of COVID. And I worry a lot about guilt and stress and kids and families. And so the masks, they've become a political symbol in this country. They're not political to me. They are only about doing everything we can to protect Chicagoans, to have our economy open, which, as we saw, indirectly has, when people lose their jobs, it's like the biggest stressor from a mental health standpoint, and to get past COVID. So I'm really excited that kids will likely have, 5 to 11-year-olds will likely have the opportunity quite soon to get vaccinated. I know that's going to be a load off parents and some children's minds from an anxiety standpoint. But in the meantime, if we cannot further inflame anxieties and debate here, for the most part here in Chicago, I think we've done a very good job of being supportive of each other. COVID is the enemy. We are not each other's enemy.
Yeah, we have got to get back, I think, as a country to not everything needs to be a brawl.
Yeah.
Not everything needs to be a big political drag-out fight. There are certain things we can do to take care of ourselves and take care of one another as Americans, as Chicagoans. That's just a good thing to do.
Yeah.
And this is one of those things. Nobody's thrilled about it. I get it. I'm not thrilled about wearing a mask. I'd rather take mine off too. But it's something for right now we're doing to get through this, to get life back to normal as quickly as possible.
Yeah, and you've heard me say it a million times. Obviously, vaccine is the most important thing. But the masks are part of that while we remain. And it's just based on the likelihood. It's just a math problem. It's the likelihood that in a city of this size, when we are detecting this much COVID, with this positivity, what is the likelihood that you are going to run into somebody, you're going to have a close contact with somebody who has COVID and doesn't know it? That is what that's based on. And so anyway, I know we're just about at time here. Is there anything else that you want to add a little bit, that we didn't get a chance to address here? I hope it's been an interesting conversation for you. We certainly spend a lot of time at CDPH thinking about mental health, how to get more people access to mental health, and how to fill in the really big gaps that we have in this city.
I think the biggest thing I would say is just, the fact that we've increased the budget by 7-fold, more services for more people. I'm so grateful that those investments were made leading up to the pandemic, because gosh, we've needed it.
That's right.
And so I think I just want you to know that the city sees this need. That's why we're moving as quickly as we're moving. we're going to be, if the budget passes as is, pushing millions and millions of dollars out quickly in the next 6 months to open more services in more communities. We're looking at wait lists to see where we can add more therapists to reduce wait lists. So, I'm happy to come back and talk about it more, but just we're really excited about the direction it's going, and it's needed right now.
Yeah, so thanks. And I appreciate you coming back. And, we didn't even get to all the mental health questions, but for those of you, a lot of booster questions, of course. We will talk in excessive detail the next time we are on about where we are with boosters. But thank you. And we do keep track of the questions that we don't get to during, the live session. So we'll try to get to some of them the next time around. Thanks again for your attention. Thank you to Matt Richards, Deputy Commissioner at Behavioral Health. Have a really good day.